Welcome to On the Spectrum. I'm your host, Terry Matthews, and today I'm bringing you an important topic that must be discussed. Did you know that studies reflect that every 2 minutes that there is a sexually victimized crime that occurs somewhere in the United States, and it even happens more in individuals with disabilities? Joining me today is Dr. Lydia Sit, who we will be discussing what you should look for and identifying if your child has been sexually abused. Dr. Lydia Sit, thank you for being here.
Thanks for having me.
I'm going to call you Dr. Lydia if you don't mind.
Sure.
So this is a very, very sensitive subject. One, people don't talk about sexual abuse, whether it's in neurotypical individuals or people that, are diagnosed with autism. We just don't talk enough about it. Sometimes a lot of these subjects are left behind closed doors. So I'm so glad to be able to highlight these things. And I really, really want to equip our audience on what things to look for, because this was a big scare for me with having a kid that was nonverbal. So tell me, what has been your experience in this area of sexual abuse and individuals with autism?
Well, unfortunately, it is common, and probably even more common than we have the statistics to substantiate. Because As we know, like you said, having any kind of disability puts you more vulnerable at risk for these types of incidents from happening, and a lot of them remain unreported.
Wow, unreported. Do you think that it's a fear or a concern because maybe parents aren't sure who or how to report it, or potentially maybe having a child not be able to speak up and say, this person did this to me? Is that why you think that it's not reported as much?
There are probably multiple factors, but that's definitely the case. I think that sexual education for those children that are on the spectrum just isn't where it should be. So it can be very difficult, especially with communication issues, and also understanding social norms to know when something wrong has been done. And we just live in a culture and a society that keeps secrets, and sometimes talking about sex, talking about these private areas can feel embarrassing, and therefore we kind of just push it aside.
And I think sometimes when you are so concerned with maybe all of the other deficits that you might be dealing with, maybe that's not a thought. Maybe it's not, hey, when do I teach my child that it's wrong to touch you here or to touch you there, or how to even raise their hand, to tell potentially even on somebody who may be helping them, that's supposed to be there to stand in place to help them with some of their learning differences, but might be a person that's victimizing them. What would be your recommendation? Like, is there an age that you start having these conversations? Is there a way you start having these conversations?
Well, it's so important to be proactive and start it early. Just like our neurotypical children, we need to, before they start getting interested in sex, before some incident happens, to starting in maybe even preschool, depending on their ability level, teach them about body parts, teach them about private parts, what are the rules around privacy, body ownership, my body is mine, and ways to say no.
Is there a way to prevent sexual abuse?
There are things that we can do, and especially I think one thing that's an important thing to underscore, just like you had said before, is that it's not typically strangers that are involved in these sexual abuse cases.
Right.
Over 90, maybe even over 90, upwards of 95% of the cases are with people that the child is already familiar with. So instead of teaching the stranger danger thing that I think I remember when I was younger.
Jaden still uses that today. He woke up today. All these strangers in the house, stranger danger.
Well, in that case, I mean, we kind of look that way. But in regards to sexual abuse, we are now shifting towards strange behavior. And the concept that some people are capable of bad things, and these can be even people we're familiar with, teachers, coaches, even family members or other kids.
So how would you identify if you've had a child that's been sexually abused? Let's assume you have, tried to teach, or maybe you forgot to teach. So for those parents who are out there who are raising an individual on the spectrum, if unfortunately something like this has happened to your child and you didn't have the tools or you weren't sure to do it, I just want you to understand, don't beat yourself up. We're trying to continue to educate people about how to handle this, how to deal with it, and I don't want you to feel bad because maybe something's happened to your child and you didn't understand that you should have been having these kind of conversations early on. But what I want to say to you, Dr. Lydia, is that, if you have a child, what are kind of that's nonverbal or even verbal, but especially our nonverbal community, how do you identify when something's wrong? Like, is there something that you see that changes that's different in your child?
Yeah, I'll start off with physical symptoms, even though they're a little bit more rare. So difficulty toileting, bedwetting, difficulty walking, bruising around the genital area, unusual discharge, or other signs there could be an active STD. Those are all obviously huge red flags that something has gone on. Right. But if you're just waiting for the physical symptoms, you're going to miss a lot of potential clues, because most of them tend to be more emotional and behavioral. Agitation, irritability, depression, withdrawal, anger outbursts, changes in their stimming behavior, perhaps more self-injurious behavior, sexualized play, inappropriate sexual language. These all can be warning signs. And there are also warning signs that can be in the environment as well. If you're noticing that there are adults that are paying special attention to your child, giving them gifts, offering to take them on trips, if your child is hanging out with an older age peer group, any of these can be warning signs. Ultimately, you just have to trust your instincts, because some of these are just very subtle signs. If you notice just somehow that something feels off, and you can't necessarily name it, but something feels wrong, you need to investigate it.
I think that's what's important, because sometimes with our kids, some of those behaviors that you talked about sometimes come along with our children that are on the spectrum naturally. But sometimes we don't identify that it's a little bit more than what it used to be, or maybe we think that they're just going through a tough time, or they're changing, from one age to the other, because autistic kids also go through puberty just like everybody else. And so we will lean on those things, we'll try to justify. But what I hear you saying is, when you see these things, take a moment, investigate, even if it is they're just going through the natural puberty change, but being willing to hear what they're saying when they're not saying anything at all, right?
Exactly.
Any advice that you would give to parents if they find out that, or discover that maybe their child has been sexually abused? Where do they start? Because there's a level of embarrassment that happens. What did I do wrong as a parent? Was I not there? How did I not notice? Why did I allow, this individual, even though you didn't? I've had cases where a parent hired an individual to provide services to their child, and that child was sexually abused in that. And so there's a lot of parents who fall into depression and don't still seek the services that they need for their child to manage through what has happened to them. So what would you recommend if a parent finds out, hey, I think my child's been touched? What do they do next?
First of all, that's completely understandable. I'm a parent myself, so obviously this is one of your worst nightmares as a parent.
Absolutely.
So those feelings of anguish or self-blame, I can totally understand where that comes from. However, when a child is disclosing something to you, it's so important that despite whatever your feelings are, you have to push them aside, and you have to be present and able to listen to what the child is saying, and you have to be able to reassure them that you do not see them any differently, that you love them, that you believe them, and that you guys are going to get through this together.
That's important. The part that it's okay to say, what you need to say to me, so that we can get help together. That's good advice. Thank you for that.
Because, children want to protect us, and that's often the reason why these things are kept secret. So if they see you fall apart, they're going to be more likely to feel, first off, that maybe they were somehow to blame, or that maybe they'll recant what they say because they don't want to hurt us. So we just have to be strong. Find some other place to vent about your feelings, which again, like I said, are totally understandable and natural, but in that moment, get the help that you need. And if there's an immediate danger, call 911.
So anytime there's an immediate danger, call 911. And sometimes the strangers, like you were just mentioning, the statistics are so high, we always think it's a stranger, but it's not necessarily always a stranger. 9 times out of 10, it's somebody that we know or someone that our child knows. Are there any recommendations that you have in reference to the ongoing help that children on the spectrum might need? Because I think when you have a kid that may not communicate as well, then oftentimes people don't think that they need to get help, or how are they going to go to a therapist? They don't really speak. And I'm not saying that they're necessarily nonverbal, they just might not be as social. So I think that's a myth. I think that people need to understand you still should seek help for this individual. Would you recommend that as well?
Absolutely. I mean, after a report is made, and you probably would call something like the national hotline, which is 1-800 like number 4 a child. They would direct you to a child advocacy center where they would be able to interview the child in a safe environment, if necessary, do a medical examination to collect any evidence. And the time window is short. It's probably about 72 hours, so you need to act quickly. But they also have the resources for the support afterwards, which, like you said, is so key. Support for your child and support for you as well. There are other forms of therapy other than just talking out about feelings. There's family therapy, there's play therapy, there's all different types of modality that are very trauma-based and can be very helpful.
And if I could just say anything to individuals that are out there, I think this is extremely important. Please continue to, send in your comments in reference to maybe your experience, your knowledge when it comes to receiving services or helping those individuals who unfortunately have gone through sexual abuse. But I also want parents to know, because there have been times, I remember Jaden being nonverbal and him having a bruise that actually came from school. Now, I dealt with the school. I'm kind of like roll up your sleeves, kind of duke it out mom, advocating for my kid. But what I want to say is that there were times that I thought, oh my gosh, if I ever had to make a report, what if they thought it was me? You know what I mean? Like, everybody's guilty initially, even though they say you're innocent. So for the parents that are out there that have a situation, I want you to understand that you still need to make the call. As long as you're not guilty, they will figure out that you're not guilty. You still need to make the call. Don't be afraid to reach out for help thinking that you're going to be accused or have your child taken away from you, because it's better that your child gets the help that they need early on. So to your point, these behaviors, because if they don't know how to deal with these behaviors internally, you can see them manifest inappropriately as they get older.
Absolutely. I mean, it's about the safety of your child, and it's probably about the safety of the other children, whoever that perpetrator is out there. Absolutely.
And that's key, the safety of other children. You could be saving other children's lives. Thank you so much for being here today. This is such a tough subject for me. I'm stumbling over my words because inside I'm like, it is a challenge when I've seen so many parents deal with this time in and time out. I mean, even as an example, having a child get off of a school bus whose pants were unzipped, no question, no concern. If you have as a parent, don't feel like, oh, I'm overthinking this, I'm exaggerating this. There's nothing wrong with investigating what's best for your child. And in this case, a child was getting off the bus constantly with their pants unzipped. The bus was consistently late. And she allowed it to happen for a period of time just because she thought she was worrying for no reason. And then unfortunately, we found out that there was a reason. So again, no question, whatever you feel, this is your child, and it is okay to raise your hand and say, hey, I don't like what's going on. I don't feel good inside about something. To your point, I think you said it best. If you just don't feel right about something and you're not sure what it is, investigate, right? Investigate.
Absolutely.
I wanted to address too, because we are talking about kids as well as teenagers, but there are adults that are living on the spectrum as well, and they live alone. And I unfortunately have had to deal with these sort of cases as well, advocating for individuals who have been sexually violated as an adult. And what would be your recommendation if a person out there that is autistic has been sexually violated? Because I've heard them be told, well, you wanted it. and they don't know how to say, no, I didn't. You know, you might have offered me something and I took what you offered, but I didn't know it came with being sexually assaulted. So what would be your conversation that you would have with an adult that's on the spectrum that's been sexually assaulted, male or female?
I mean, a careful discussion about exactly what happened, and providing the education that, you know, sex has a time and place that is between two consenting people, and describe what that consent means, and that it shouldn't be given away freely. It's not a way to gain friends. It is something that you do when in their time and right place. And given that context, what is their conception of what had happened, and sort of be able to walk through it with them to see, to explore their feelings and allow for, you know, the other thing that could get confusing is that if we still talk about good touch, bad touch, there are some inappropriate forms of touch that might feel good. There are parts of it that they might have enjoyed, but just because there were parts of it that they might have said okay to doesn't mean the whole thing was appropriate. And sort of guiding them through step by step through that process and allowing them to talk about their feelings and reinforcing the subject that their body is their own. They can make the rules, they can reinforce their boundaries and actually teach them a dialogue of how to do that.
So for adult that's out there, is there a hotline or a number that they can call, assuming they might not have an advocate or they're scared to maybe share something with somebody who might be a level of support system for them? Is there somewhere they can call just to kind of have these conversations? Is it a regular hotline of assault, or is there a special hotline for individuals on the spectrum?
Well, they could definitely call a domestic abuse hotline. They can call 911. I have talked to the child advocacy centers, and they are actually okay and willing to talk to even adults if they're on the spectrum, because sometimes the way that they can interview and talk and have these discussions is a little bit more sensitive, given that population.
Thank you so much. This is just so much great information, very tough subject, but the information that needs to continue to remain on the forefront. We talk a lot about the therapies. We talk a lot about, you know, how to make your child speak more, or deal with sensory issues, or even jobs, but we don't talk about sex and appropriate sexual interactions between individuals. Thank you, Dr. Lydia, for being here today from the Philadelphia Mental Health Centers. This has been great information, and I know that our parents and the resources out there for our teachers and folks who support those that are on the spectrum, this is just going to be great information for them.
Thanks for having me. It's been an honor.
That's all the time we have on Let's Talk. For more information about how you can either join our show, download our resources, please leave us some comments below, or subscribe. Log on to www.onthespectrum.tv. Thank you for joining us, and see you next time on The Spectrum.